Hello. Welcome to TopBond TV. Thank you for tuning in. Thank you for watching. Thank you for liking, and also thank you for sharing. Before I start the whole video for today, I would like to make a statement. I've had a problem with my YouTube channel a little bit. For some time now, it's been rough. That's why you don't see me a lot. I've lost some subscribers and some views and a whole lot of stuff happening right now. So as you watch this video, I will ask and plead that you just check on your subscription button. If you have been unsubscribed, then I will ask that you subscribe again, and then ask friends to also subscribe, share to friends who previously had subscribed to also check and then subscribe again, so that whenever I post a video or I put down anything, you will still get to watch. Okay, yes. So before I start today's video, I will say again, thank you for tuning in and thank you for subscribing again. Let me ask you a question, okay? Today's video is a bit different, and I'll ask this question to start with. What kind of work do you do? Are you a driver? Are you a teacher? Or do you work from home? Think about it. The reason why I'm asking this question is the work that we do could have effect on us. It could either make us live healthy, or it could make us live anyhow. I'm talking about our diet. So the job we do can significantly affect our diet, and it could lead us to getting some diseases or illnesses or sickness that could have been prevented. Today, my topic, or what I would want to talk about, is simply pre-diabetes. Now, pre-diabetes is more like this. When pre-diabetes escalates, right? When it goes up, then it develops into diabetes type 2 diabetes. So that means people who are who have type 2 diabetes usually starts with being pre-diabetic. Now, the good news is we can prevent it from happening. We can prevent type 2 diabetes from happening. That means it could be reversed, but it all depends on us. That is why I asked earlier the kind of work you do. Is it affecting the way that you eat, or it doesn't at all? That's something that we need to look at, so that we could live healthy when it comes to our diet. Okay? Now, someone will ask what pre-diabetes is. Pre-diabetes is simply when your blood sugar level is higher than it should be, but not higher enough for your doctor to diagnose you with diabetes. So let's say your the normal blood sugar level is 70 to 105 as per some hospital policy. Being pre-diabetic means your blood sugar is more than 105 to probably 135, 140, maybe 150. Now, you would want to bring it to normal. You want it to bring it normal to 70 to 105. If you are not able to bring it to the normal range and it keeps going up, then you become type 2 diabetic patient. You don't want your situation to get to that extent. So now we have to watch our diet. One thing you should know is people with diabetes mostly always start from being pre-diabetic. Okay, that's when, or that's where it always starts from, pre-diabetes. So in this case, I'll tell you this. Someone will ask, how would I know if I have pre-diabetes? Now, being pre-diabetic usually have no symptoms. There are no symptoms. So you might not even know if you have it or not. But sometimes, if you know your family history, if you know if your mother or if your father had diabetes, then your chances of being diabetic is high. So now that should tell you something, that you need to watch your diet. Okay? Now, talking about it could be reversed. Yes, it could be reversed. And this is how. It could be reversed by or with our lifestyles. You know, having a lifestyle change could actually help bring our blood sugar levels to normal. Lifestyle changes. When I say lifestyle changes, I simply mean weight loss. That's one. So if you think you are overweight or you are obese, then you would want to, start losing weight to prevent your risk of being diabetic or being type 2 diabetic patient. Another thing that we could also do is also to watch our diet. So if you start eating, food less in carbohydrates, food less in fat. Now, when I say fat, we have people that when they are eating chicken, they like the skin more than the meat. But the skin is where the fat is. So if you want to prevent that, then you better eat the meat of chicken and then avoid eating the skin. This simply means that you are eating less fat. That's one way of eating less fat in diet. You have to also eat less or no red meat at all. When I say red meat, I simply mean goat, sheep, cow, those, meat like that. Some people even eat dog. They are all considered as red meat. It's either you eat very less or you don't eat red meat at all. Thank God you can eat chicken, but not the skin. That means we can still eat meat. Right? Another thing that we can do is exercise. Another thing that we can do is exercise. We have to develop the habit of exercising regularly. And that's how we could also prevent, our pre-diabetes from escalating to being type 2 diabetes. What happens when we exercise is we burn some sugar, okay? People who are really like diabetic patients, when you exercise, it serves as insulin. So, let's say one exercise is equal to one injection of insulin. But this is the case, you are not considered as diabetic yet, which means exercise will just prevent it from even happening. So exercise is also a good thing to do. Now, another thing that I would tell you is medications. If some people know already that they are pre-diabetic, right? So you can actually be on medications like metformin. I'm not a doctor and I'm not prescribing a medication for you. I'm just telling you what some people could take to bring their sugar levels down. Okay, so now we have about 5 things that could help prevent us from being type 2 diabetes, from bringing that would help us bring our blood sugar levels to the normal range, which is 70 to 105. How do you check your blood sugar levels? We have an equipment for that, but if you don't have it, you don't force yourself. You can either see your primary health doctor, You can see your primary health doctor to check your A1C level or to check your blood sugar levels to see where you are at. And that's how you know the range, and then you start working on that. Okay, there are some people, I mean, probably some people have started getting some symptoms like this. When you are hungry, you start getting angry, or you get headaches. Sometimes, you know, when you're hungry, you start feeling dizzy and then you start shaking and all of that. When you start seeing these symptoms, that means yours is a bit getting out of hands. You are almost at type 2 diabetes, or maybe you are already there and you can't even play with it. Okay? So start working on your diet, start exercising, and try to lose some weight, and it will save you a lot of stress. I hope this helps. Don't forget to subscribe, like, share to friends and family. I think this is a very good information to help prevent us from getting sicker. Okay, and also, like I said earlier, check your subscribe button. If you are unsubscribed, then kindly subscribe again, and until then we will meet again. Have a blessed day. Bye bye.